Good afternoon. My name is Maisy Hammond, and I will be speaking about the role of the nurse combating vaping against children aged 12 to 18 years old. The role of the nurse in the community extends beyond providing medical treatment and healthcare. Nurses play a major role in advocating for vulnerable populations and providing healthcare in diverse ways. For nurses in the community combating adolescents vaping, they can provide healthcare by raising awareness of the health risks of vaping and conducting risk assessments of children vulnerable to vaping. Additionally, nurses can educate parents and caregivers on the risks and effects of vaping and can collaborate with home services, school leaders, psychologists, and multidisciplinary teams to ensure children are provided with the best care and options to prevent or quit vaping. Due to an Australian student culture of wanting to fit in, nurses must use a variety of approaches to raise awareness and educate children on the health risks associated with vaping. Utilising posters and seminars may not captivate the attention of the target audience, 12 to 18-year-olds, as the coolness associated with vaping outweighs the health risks. A nurse's role in raising adolescents' awareness of the hazards of vaping should be informed by the third strategy of the Ottawa Charter, that is, mediating between different interests in society in the pursuit of health. For adolescents, this would be raising awareness through alternative means such as social media. Nurses are required to complete risk assessments of adolescents who are at risk of vaping. Studies have shown that children of parents and caregivers who smoke cigarettes or vape have an increased risk of taking up the same habit. For nurses working within schools, this may require working closely with adolescents whose parents are smokers to enhance health literacy before the children begin to vape. By utilising primary prevention strategies, nurses can identify students at the greatest risk of vaping and ensure they are put in contact with the proper services and support to prevent them from vaping. Furthermore, early intervention and education for parents, encouraging them to adopt healthy habits, can prevent children from starting to vape. Another significant role for nurses within the community is providing education and strategies to caregivers who are supporting an adolescent to stop vaping. Nurses can provide caregivers with health information and strategies on how to best support their child. Furthermore, identifying caregivers who may have lower health literacy is an integral role of nurses. This includes identifying families of lower socioeconomic status who are at a higher risk of low health literacy. Through identification of caregivers with low health literacy, nurses can connect them with support groups and other health professionals. These services can provide further support and consistent and ongoing education regarding the risks of vaping and how to help their child quit. Finally, nurses play a crucial role in collaborating with multidisciplinary health teams to ensure adolescents and parents are getting the best, most personalised care for their health journey. Nurses within school communities can collaborate with school nurses, psychologists, home services, doctors, and support groups to ensure that adolescents that are trying to quit vaping have the constant support they require. School nurses have a unique perspective and insight into a child's life, given they see them at school for most of the week. Including school nurses within a multidisciplinary healthcare team ensures they can bring this perspective and insight to any healthcare plans. School nurses can also provide children with regular checkups at school and support them with concentration issues secondary to vaping. By collaborating with psychologists and specialists, nurses can ensure that adolescents who are experiencing mental health issues associated with vaping can be effectively supported to address these issues and use healthy coping mechanisms to quit vaping. This can help to improve adolescents' health promotion as they have the support required to be accountable for their own actions and health when quitting vaping. So, how can nurses implement strategies to prevent vaping in adolescents? When caring for adolescents aged 12 to 18 years old, nurses must find unique and creative ways to engage, educate, and advocate for the youth within their community regarding the risks associated with vaping. Due to an age range of the target audience, pamphlets and seminars may not be the most effective way to communicate the risks associated with vaping. However, nurses can utilise social media as an age-appropriate way to get information across to adolescents. Creating fun and informative videos and posting them on a health and wellbeing focused TikTok page can be an effective way to communicate the risks of vaping to adolescents. Furthermore, nurses can collaborate with schools to market their TikTok page to adolescents to ensure that their video is being seen by the target audience. One challenge with any health promotion communication strategy is the significant age range of adolescents being targeted. 12-year-olds that vape may not respond to communication strategies that 18-year-olds may respond to, as they may be vaping for different reasons. Nurses need to ensure that the information provided and methods used for communication is age appropriate. For example, children aged 12 to 13 may respond to a fun and interactive seminar run in school. Nurses could employ a mobile van that travels from school to school, educating 12 to 13-year-olds about the risks of vaping and nicotine, similar to the Healthy Harold van, which uses a giraffe puppet to educate children. However, 17 to 18-year-old students may find this boring and not respond to puppets as younger children may. Nurses could change their approach for older adolescents by interacting with them through sporting clubs and extracurricular activities. Nurses can promote the benefits of sport and activities to 17 to 18-year-olds and encourage interaction outside of school hours to promote healthy lifestyle habits. Finally, nurses are required to advocate not only for their patient, but for the implementation of policy to benefit their health and well-being of the community they serve. School nurses have a unique perspective and insight into the child's school and personal life as they see students daily. School nurses can advocate for in-school counselling specialised to vaping and risk assessments for parents and students who are at risk of vaping or smoking. If school nurses advocate for or set policies regarding to the need of students at risk or currently smoke vaping to have access to specialised counselling, this would promote mental health support for children and healthy lifestyle habits. School nurses can also collaborate with nurses external to schools regarding the need for seminar risks, assessment policies, and sporting clubs and extracurricular programs within GP clinics to help identify kids at risk of vaping. Thank you for listening.